Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hip. It is Thomas test. This test came from way back in the 1800s by Dr. Hugh Owen Thomas. He was doing a lot of work with the joints in the lower extremities, and he was talking a lot about contractures, and he came up with this test to test for a hip contracture. And he talks about it in his book, Diseases of the Hip, Knee, and Ankle Joints with Their Deformities Treated by New and Effective Methods. Whew, that's a long title. You know, some light evening reading there. And to perform the test, you have the person laying supine. You want to make sure that the lumbar spine is in a neutral position, the sacrum and all that is on the table. And then what you do is you bring one leg up toward the chest, and we want to see what is that other leg doing. If it starts to raise up, we can say, well, this person may have a hip flexion contracture. Now, you may be saying, Matt, what are you talking about? I learned that test a different way. Yes, that's how I learned it, and that is the modified Thomas test. That test is a little different. It's looking at the flexibility of those hip flexor muscles, those hip muscles. So this test, I'm going to have Mateo come here toward the end for me. So we come here toward the end. Your patient, you want their behind right there at the edge of the table. And in the description of it, you support their back and their leg. You have them drop back there. And while maintaining that leg in the 90 degrees, we want to see what that other leg does. So if it, oh, and I'm sorry, I left this part out, and this is very important. We stabilize the ASIS here. So we stabilize the pelvis as we bring them up as well. And I'm going to talk about why that's important here in a moment. So we stabilize that and see what that other leg does. So if this leg stays down, just like this one, it's a negative. However, if Mateo is sitting here and his leg raises up with the knee bent, it could be a tightness of the iliopsoas. Or if the leg is out this way and hanging out, it could be a tight rectus femoris. Or if the leg is abducted and externally rotated, it could be tightness in the TFL. So what I mentioned earlier, where I left off the ASIS, that kind of plays into some of the reliability. Because there is evidence that it is a reliable test, it's a good test, but there's some other stuff that says it's not. But there is a paper that found that the reliability and all that improves when there is stabilization in the lumbopelvic region. And that's something that gets missed in some of the papers. And the reason for that is that a person's pelvis could anteriorly rotate or posteriorly rotate based upon like their size or however that they move, and it can just throw off the test. So in their paper they said the reliability becomes much better when you stabilize that lumbopelvic region. So keep that in mind. If you do that, stabilize that pelvis as you assess them, so you're not going to get, you know, any of these other things there. So that is Thomas test and modified Thomas test. Let me know what you think about it. Do you use this test? Do you think it's a good one? Do you think, you know, hey, we need to throw out all those other studies and we need to kind of standardize this test a little bit better? So let me know that down in the comments below. And of course, if you enjoyed the video, please hit the thumbs up or the like button down below. And as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.